My name is Brooke,
And I'm Jenny.
and we'll be talking about the post-op care of the cleft lip and palate. So to dive into this presentation, we wanted to first talk about what a cleft lip and cleft palate is to make sense of the post-operative care that is needed. The cleft lip or palate occurs very early in the development of an unborn child. Most often, the cause is unknown. Surgery is required to repair cleft lip and/or cleft palate. Typically, a surgery for cleft lip is an infant who is 3 months, and for the palate, the baby has to be 12 to 18 months due to the palate growing.
All right, protecting the repair post-op. So the palate needs to be protected 3 weeks following the surgery. Hard objects need to be kept out of the child's reach while the palate is healing. That's why the child will wear the welcome sleeves, the blue and pink objects pictured.
To clean a child's teeth and gums, use a gauze pad dipped in plain water or a small amount of mouthwash mixed with water. Wipe the front of the teeth only. And for the patient education, do not use a toothbrush in your child's mouth for 3 weeks, and have your child drink water after eating to clean the mouth.
So feeding instructions for your child. A cup or side of the spoon should be used to drop the food into the mouth. Do not allow the spoon to touch the roof of the mouth and possibly damage the incision site. Do not allow the child to chew on anything. Remember, no pacifiers or bottles need to be used. After each feeding, rinse the surgical site with normal water. Do not give any hot foods or liquids. A doctor or speech pathologist will meet with your patient and the patient's family after surgery to discuss individualized feeding plans.
So for the first week, the diet consists of fluid. This includes milk, formula, juices, well-melted ice cream, and slightly warm broth.
So in the second week, we can move on to a soft diet, and that consists of foods that can melt in the mouth, like ice cream, sherbet, frozen yogurts, puddings, custard, and pureed baby foods. So do not give the patient any kind of foods that need to be chewed. It's important to think about age-appropriate foods at this point, so a patient over 6 months should still be taking formula or breast milk. So at activity and play, once we're discharged home, your child can go back to playing as normal, but they need to be watched. They should keep those arm splints on for 3 weeks. The parents need to monitor other children because they could possibly give the child who's been operated on objects that they could eat or play with and put in their mouth. Soft toys are best for these kids, like the elephant pictured.
So for medications for pain, you'll be given ibuprofen, Tylenol, or morphine, and the patient will also be sent home with an antibiotic.
So notify the physician if the child is experiencing a fever over 101.4, pain that does not go away even with administration of medicine, any injury to the incision site or possible bleeding from the mouth, trouble drinking or eating, and a dry diaper for more than 8 hours.
The first ACI question is, the nurse is caring for a newly admitted school-aged child who has hypothyroidism. Which of the following medications should the nurse instruct the child to recommend to the parents treating the child's condition? First, vasopressin. Vasopressin is associated with diabetes insipidus, and one way to remember this is if you look at the first letter D and then the second to last letter I, and think diabetes insipidus. For luteinizing hormone releasing hormone, this doesn't really pertain because we don't want to keep the body from not releasing a hormone when we're already hypo in hormones. Recombinant growth hormone. This is for children who do not grow normally or are on the normal growth. So this does not apply as well. Levothyroxine is the answer because it is a thyroid medication that replaces a hormone normally produced by your thyroid glands.
All right, so a nurse is providing teaching for the parent of an infant who has diaper dermatitis. The nurse should teach the parent to apply which of the following to the affected areas: zinc oxide, antibiotic ointment, talcum powder, or an antiseptic solution. So diaper dermatitis is another way to say diaper rash. So we usually use zinc oxide to treat and prevent diaper rash. Antibiotic ointment is not the answer because a topical ointment can be used to treat certain skin infections, but not dermatitis. So it will be used to treat wounds or burns or boils or things in that realm. So talcum powder is not recommended, and it should not be used because the patient could inhale it and cause respiratory problems because it could enter the lungs. An antiseptic solution should never be applied to the body. It should only be used to disinfect non-living surfaces such as a counter or a handrail. So zinc oxide is the answer.
Lastly, first, use the second dose if the first one does not completely reverse symptoms. Pray. B. Store unused episodes in your refrigerator. You don't store episodes in a refrigerator, so no. Shake the episodes before using to dissolve the precipitant. This is a clear cloudy mixture, so no, you don't shake the episodes. When administering the medications that you in the back of the arm, administered, no. We administer in the thigh, so this does not apply as well. So the correct answer is use the second dose if the first one does not completely reverse symptoms.
So these are our resources we pulled from the Smile Train. We pulled from the Cleft Lip and Palate Association. We also pulled from Dartmouth. And we pulled from Nationwide Children's Hospital. Thank you.
Thank you.